think is the most common cancer? What is it? Leukemia. It's not leukemia. That's a good guess. The most common cancer, young guys between the ages of 15 and 25.
I forget what it's called.
You know what it is, Mr. Garcia? It's testicular cancer. It's exactly what it is.
Who said that?
Mr. Christie.
Testicular cancer is the most common type of cancer. So what that means is, guys, you got to do the same thing every once in a while. You got to squeeze your boys down there. Not now, save it for later. Right, squeeze your boys. And what you want to do is you want to feel to see if you can actually feel a tumor. Well, I work in healthcare, and I think you guys really need to hear this message. When young people get diagnosed with cancer, many times by the time they get diagnosed with it, it's very advanced. Because the reality is, women, you know the deal. If you get a really small tumor, they find a small tumor in one of your breasts and it's the size of a pea, what do? They just cut off that little tumor, boop, and you're good to go. Guys, if they find a small little tumor in one of your boys down there, in one of your testicles, you know what they do? Boop, they just cut off that little thing and you throw it. However, if it's pretty advanced and it's pretty big, ladies, what do they do with a really big tumor in your breast? What do they do, ladies?
Take away your breast.
That's right, they cut off your breast.
Oh,
and if it's real, and it's real advanced and it's inside your arms, you know what they do? It's called a radical mastectomy. And the word radical means they take some of your lung tissue off, they take some of your armpit tissue off, and they take all this whole area to try to stop it.
And what about skin cancer?
Same with skin cancer. Depending on where on your skin it is, they just try to remove it where it is, as long as it hasn't spread. So guys, what if they find this little small tumor on one of your testicles? You know what they do? Boop, they just cut it off. Well, what if it's a really big tumor? What do they do?
Cut your whole...
Cut off the boys. Ouch! Yeah, that's what they do.
Thanks.
That's nasty, but that's true. Cut them all. So that's why I think it's important. I know that you guys can think that this is funny. That's all right. We can play around a little bit. But the reality is... The reality is, if you ever put a self-exam,
if you have one nut, can you still have a baby?
If you have one nut, yes, you can have a baby with one nut.
Oh,
wouldn't it be hard?
You have to work twice as hard. Just do your business, brother. Do it well. Get an erection? You can with just one nut. Yes, you still can.
Because I knew somebody with one nut.
I knew. No, I knew somebody with one nut.
Maybe they did something.
My friend Greg got one nut.
Well, here's the deal, guys. The reason young people, when they get diagnosed, is pretty advanced, is because, just like my man over here said, I don't know if he was playing, but he said, man, I'd rather die. But the reality is, what happens is, if a guy finds something on one of his testicles, or women find something on one of their breasts, they do not want to go to the doctor. Women don't want to go to the doctor and say, okay, doctor, check them out. And guys don't want to go to the doctor and drop their pants and say, go ahead, doc, check them out, go ahead. Right? You get embarrassed, it feels too weird, you don't do it. So you just ignore it, you let it go, you let it go. And what do you think you're doing by letting it go and letting it go?
It gets bigger.
It gets bigger and it gets bigger. And you ignore it, you let it go, you let it go, you let it go, and then it's really a problem. So my encouragement to you is, I know we're just playing a little bit, but my encouragement to you in all seriousness is, if you ever find something that just doesn't belong there, it's a lump, it feels like a little pea or a little peanut or something that just doesn't feel right, you got to get it checked out, because the longer you wait, that means the bigger it's going to get and the more problems it's going to give you. All right, I don't want to scare all you people, but that's what cancer is. The third leading cause of death in America is a stroke. And actually a stroke is, they're actually changing the name of the hospital from a stroke to like a brain attack, because everybody knows and understands what a heart attack is. And a stroke is really the same thing, except it happens in your brain. That you don't get enough oxygen to your brain. Sylvester has a little something different. That's called Bell's palsy. That's a little different, yeah. But a stroke is actually you don't get enough oxygen to your brain and actually paralyzes a part of your body. Oh. Yeah, it's a nasty thing to have a stroke. It's pretty, but we know that smoking is a risk factor because it also constricts and tightens up the blood vessels going to your brain. Well, the one that we deal with most at the hospital when it comes to smoking cigarettes is this bad boy here, is lung disease. What lung disease is, inside of our body, we have lungs, and we have these little air sacs at the end of our lungs that sort of inflate and deflate like this. That whenever we take a big breath, it inflates and deflates. And what happens sometimes is our lung tissue becomes over-distended. It's this disease called emphysema. You ever heard of the disease, emphysema? Yeah, emphysema is a disease that 95% of people get emphysema directly from smoking cigarettes.
Why is there all these weird diseases?
Why is it what?
Why is there all these weird diseases?
Why is there so many weird diseases?
Yeah.
because our body is very complex and there's different parts of our body that don't work properly like they're supposed to. And sometimes it's environmental, which means something that we bring into our body like alcohol, drugs, tobacco, bad choices, bad diet. And sometimes it's we don't really have a reason. Sometimes for no reason, whatever, something just doesn't work right in your body.
Well, how come Mr. Christian teaches?
How come what? This is a little different lesson. He teaches science. It's a different
Well, I
set.
teach physical science, which is
Yeah, this is more like human science. We're talking about the body.
which is what you learn in 7th grade.
And there's some diseases that people get for no reason of their own. Mr. Christie and I were talking in the last class, and I have one of my sweetest aunts in Puerto Rico. She died a couple years ago of this disease called pulmonary fibrosis, and it's when your lungs get real stiff. And they're sort of like lead balloons. So you see how they're expanding like this? Pulmonary fibrosis is that your lungs get like this, and they can't expand really well because they're so stiff. She never smoked, she never did any problem, and there's no reason, no excuse why she got it. It's called idiopathic pulmonary fibrosis. I don't know why she got it. And she died. She died a nasty death connected to oxygen being real short of breath.
When you talked about the bubble wrap, I
Yeah,
listened to my mom's lung doctor, and it was
How she
crackle
got
pop.
you can hear
Did
it.
you already do that? I didn't mean to pull your.
How she get it?
What's that?
How she get
They
it?
don't know. They don't know how she got
It's
it.
idiopathic, meaning they don't know. They don't have a
Idiopathic means
reason.
they have no idea, no reason how they got it, yeah. But inside of our air sacs, we have all these little alveoli, and alveoli are actually little air sacs just like this bubble wrap. And actually, you can hear, like Mr. Christie said, you can actually, if you get a stethoscope and put it on somebody's back, you can actually hear these little air sacs kind of popping like this.
Snap, crackle, pop.
Not crackle pop, that's exactly what it sounds like right there.
Do you have one?
A stethoscope? Sure, not with me now, in the hospital, sure.
I do all the
Do you have one? Can I use it? Can I see it?
So anyway, that's a nasty way to go. So that's lung disease. How do we treat lung disease? How do you treat emphysema? Does anybody know how you treat emphysema? Is there a cure for emphysema?
No.
No. The treatment for emphysema is known as symptomatic treatment. And what that means is that you just treat symptoms. If somebody's short of breath because their oxygen is low, you give them oxygen. And I'm sure you've seen people with this oxygen tubing up their nose before in the past. That's because their oxygen level is really low.
Okay, Lamar.
Use your lungs, right? Your lungs look like this. And what happens sometimes is your lungs stop functioning, and it's called respiratory failure. You know what respiratory failure is? That your lungs don't work anymore. You stop breathing. So let me show you how we treat people at the hospital with respiratory failure. So you take a bag that looks like this. You take a mask that looks like this. This is what we do. We take a mask that looks like this, put it on in front of somebody's face, their nose, and their mouth, and you push air. Don't worry, and you push air into their lungs like this. Okay. This is how you breathe for somebody. Except by doing this, the air is just going into the back of their throat. You only want to get it to go only into their lungs. Do you know how you do that? You stick a tube down their throat. You take an instrument that looks like this. This is called a laryngoscope. You take an instrument that looks like this. This laryngoscope, some batteries that go inside this part here, inside the hand, and this has a little light. It's a real bright spotlight, like a big floodlight. And you take this thing and you stick it inside, you stick it inside somebody's mouth, and you pull back on this, and it actually pries open their mouth like this. And then when you have their mouth pried open, this little light lights up the whole back of their throat. If you have this pried open, you can actually look at the inside of the back of their throat. And you look for their vocal cords, because the vocal cords is the opening to the trachea. So you take a tube like this, and you jam it down, or you gently insert it down their throat. It goes all the way down inside their throat like this. And this part is still sticking out of their mouth, so you take a syringe, and you just inflate it with air. And when you inflate it, you see that the bottom part, there's a little balloon here. So that little balloon actually wedges on the inside of the throat. So that tube here is sticking out of their mouth. Then you take this bag again, and it gets connected to the end of this tube. And then by squeezing this bag then, this is how you breathe for somebody like this. And do you guys think somebody stands here 24/7 squeezing this bag?
No.
They do it themselves? Oh, they're unconscious, they're knocked out. Sure, they have to be unconscious or else they'd be breathing. Do you think somebody stands here squeezing this bag all day long?
Not as a machine.
Very good. Take them off and you put them on a breathing machine. It's called a respirator. You put them on a breathing machine or a
Does that
respirator,
mean they keep you alive?
and the machine keeps you alive. And the machine pushes air in and out of your lungs, and that's how you stay alive. That's how you treat lung disease or respiratory failure. It's pretty nasty, isn't it? Do you guys think that that tobacco companies know that the cigarettes